Good morning, it's Dr. Patel. We're here for the first case this morning. I have my patient here with me, and she's graciously agreed to kind of let me go ahead and talk about what we're going to do today. So today what we have scheduled is a bilateral breast augmentation revision, all right? So today, like we discussed during our consultation, what we're going to do is remove your old implants. We're going to fix the pockets. You develop a little bit what we call a contracture, which is a little bit of the firmness around your implants. And you want more natural feeling implants. We're going to take out the old implants and put in the newest cohesive gel implants. You agree with that plan?
I do.
Perfect. Can I have you stand up? We're going to go ahead and get you marked right here. Oh, perfect. So once again, this is the right side, is the side where we can feel your hard capsule. This side's a bit softer. And like we discussed during the initial consultation, can I get another marker? We're not going to make any new incisions. We're going to use the old existing incisions and switch out your implants. So what we're seeing right down here is your old scar right here. We'll reuse that. And then you got another one right here. We'll reopen those, take out the old implants, fix the pockets. We'll wash out the pockets really good.
Okay.
And then we'll use something called a sizer to check the size. Because you and I discussed couple of sizes in the range. We'll see which ones give the best shape and contour for your breasts. Okay. And then we'll go ahead and put those in. And then we'll put the dressings on. You'll be all done.
Awesome.
Whole surgery, like we discussed, will take about an hour and 15 minutes.
Okay.
Any questions you have?
No, I'm a pro at this.
All right, perfect. All right, we'll see you in there, okay?
Okay,
perfect.
thank you.
This morning we're doing a bilateral breast implant exchange. We're going to the patient's previous breast incision, which is an inframammary fold incision. It's about a 3 centimeter incision where we're going to open up the breast tissue, enter the previous breast pocket, remove our old saline implants, and then we're going to wash out the pocket. She's developed some mild capsular contracture where we'll do a word called capsulotomy, which is releasing the previous scar tissue, and we'll take out any abnormal scar tissue we need to. And then we'll place sizers, which will check the contour and the size of the pocket. And then once we'll confirm the appropriate size for her, we'll take out the sizer and put in brand new cohesive gel gummy bear implants. It's a straightforward procedure. It should take us about an hour to do with a quick recovery. How you doing? It's Dr. Patel today. We have a great case today. A very common thing that I do is implant exchanges. We have a patient who had saline implant placed about 14 years ago. She's feeling a lot of rippling and she doesn't like the feel of it, and she's developed a mild capsular contracture. So she presents today. We're going to switch out both implants. She's got her previous breast incisions down in the breast fold. We're going to make little 3 centimeter incisions. We're going to remove the breast implant that she had previously. We're going to wash out the pocket, release any firmness of the capsule, and then we're going to size it for new cohesive gel implants with the latest generation. Quick procedure, takes about 45 minutes to do in the operating room, and you can have a completely refreshed look. All right, we're all done here. We went ahead and switched out our old implants, and we put in new cohesive gel implants, and we got a great result. On the left side, we fixed the pocket, had to put some stitching laterally. So we medialized their implant because it was falling into her armpit. And on the right side, she was developing capsular contracture, which is hardening of her previous scar tissue around the implant. We released that and we put in a nice new gel implant there also. We got improved symmetry and she wanted to stay the same size.